Okay, welcome everyone to our Navy Pilot feedback webinar, and hopefully everyone is able to log in using the link to see the slides, and if not, just shoot us a chat in the chat box and we can help you, or Neely can help you, try and get that link and get the slides up so you can have a visual as well as listen to the audio. So we are going to get started. And there's a couple of things that we are setting out to do today. So I have our agenda up here on the slide. I'm going to provide a summary of what we've learned so far from the pilot, so both some positive feedback and some challenges that folks have shared. I'm going to talk about the revisions that we have planned to the process based on your feedback. We're going to talk through a couple of the policy revisions that may be needed at this point based on what we're learning as we're going through this process. And we'll talk through a tentative kind of rollout plan and really hear from you about what you recommend we do as far as training and support as this rolls out to the larger Navy CYP enterprise. When you're sharing feedback, there's kind of two ways to go. You can share it verbally since we're all on the call and can hear one another. So if you want to say something so everyone can hear you, what I'm going to ask you do is raise your hand, click the raise your hand button, and then on my end of the computer I'll see your name highlighted and I'll call your name and just tell you, please press star seven to unmute your line, and then we'll all be able to hear you and you can share your feedback verbally. Or you can share it in written format. So you can type into the chat box and we can all see it. So sometimes somebody will put something in the chat box and it will prompt others to kind of agree or share their experience as well. So please feel free to use both methods for sharing feedback. They're both equally valid. I want to start by just saying thank you. I know usually we say thank you at the end of the webinar, but I really wanted to say thank you right from the beginning because I know that it hasn't been easy to learn a brand new process and also manage it alongside an existing process. So I can't tell you how grateful I am for your efforts in this process and helping us really test it out in real life and learn along the way so that when we do roll it out Navy-wide, we are starting with a very solid understanding of how it's going to go. So thank you. I really can't thank you enough for your participation in the pilot. Okay, so what are we talking about when we talk about the pilot? I just want to review quickly the forms and tools that have been put into practice through the pilot, and I want to ask you a question through a poll. So we have our health information form, which all of you used across the board with your families as they were enrolling. We have the inclusion support form, which was the 1700-52A, which is the one that kind of walks you through those series of yes or no questions to determine what your program would need to do, either have the child's case reviewed by the inclusion action team or provide the support within the program. We have the updated inclusion support plan, the support tracker, which is to be used by the direct care staff and the program leads to actually track how supports are working, the connections practices planning tool, and the environmental practices planning tool, which are both part of that program-initiated support process. So I have check marks next to the first 5 because I'm certain that folks have tried them. I am not so certain about the environmental practices planning tool. I'm not sure if folks have gotten that far in the process with the program-initiated steps. So just want to get a handle, kind of broad strokes, what you have used. So I have a poll here. If you could check the ones that your program has had adequate time to really use and try out. You can go ahead and click on all the ones that you've tried. And I'll give you a minute or two to do that. Okay. So I've got 3 responses, and let's see here. Now they're rolling in. Let's get to our results here. Okay. So this is about what I expected, that more folks would have had an opportunity to use kind of the forms that are used in the beginning of the process, and maybe not had as much of an opportunity to use some of the program-initiated tools and materials. So, but I am encouraged to see that at least a couple folks have had the chance to use that environmental practices tool. So thank you for that context. Okay, I'll start by sharing a positive. We're strength-based, and we like to start with our strengths and our positive notes to top us off here. So overall, and I'm, again, staying kind of big picture at this point, I do have a lot of details about individual forms and questions and things of that nature, but I'm just trying to keep it big picture and talk about what I've learned the main positives to be. So the first one here is the clarity of the health information form and how it's focused on relevant needs and accommodations. It seems that programs are really appreciating that they're really getting the information they need and not a lot of kind of extraneous information about needs that may not apply to CYP. So that's been a very positive experience. I've talked to many programs who have seen an elimination of the IEP review for many cases, which has been very helpful. Those kind of straightforward cases that the program is fully prepared and has the resources to accommodate. You just do what you know you need to do, and there's not a need to go to the IEP in those cases, and that's been very positive. Another positive kind of big picture thing is the flow chart feel to the forms and checklists. That really helps programs feel like, okay, we're doing our thorough review, we're making sure, checking the boxes, making sure we've done everything on this case, and that feels good because we know that we've kind of dotted all our I's and crossed all of our T's. And we've heard a lot of positive feedback about the forms and tools themselves, especially the revised inclusion support plan being more user-friendly, and parents have had really positive reaction to working with that particular format, the connections tool, and the support tracker. So I want to pause here and just give everyone an opportunity if there are other positive experiences, big picture, that you want to share. We would love to hear them. You can share them, you can raise your hand to share them, or you can share them in the chat box. Okay, I'll pause for another moment. People might be typing. Okay. We might have more hands raised when we get to the challenges, which is okay. Overall, what I've gathered from the feedback that I've received is that challenges included it really being slow to start with learning a new process and managing an existing process, which is, somewhat expected, but felt like, oh, when are we ever going to get our handle on this? Another challenge that I heard was that not many new children were enrolling, and I don't know if that was coincidence, but I heard it from more than one program that we haven't had any kids who need support. So it felt a little slow to get going, and obviously anything that is new has a learning curve and can feel like an uphill battle at times. So I heard some feedback around that. I also heard a lot of folks mention being hesitant to kind of eliminate that IEP review for significant medical needs, even if they felt like they knew what to do, had the resources, could make the accommodations. They still were hesitant to just not go to their IEP. So we're seeing some programs that even though they know what they're doing and they can accommodate those needs, they're still kind of using that IEP for those significant medical needs. So I don't know if that is across the board. So if you could type in the chat box kind of what your experience has been and how you're feeling about that, that would be great. And another challenge that I've heard is that the SIMS documentation doesn't match the pilot process terminology, and that's been a challenge, just figuring out how to use this new process and still document in SIMS appropriately when the terminologies and kind of how it's done is very different. So that's something that definitely we need to consider moving forward, is how to make those two match, or how to translate the new process into SIMS. Are there any other challenges that you want to share? If you want to just press *7, you don't have to raise your hand. *7 will unmute your phone. If you have anything else to share as far as challenges.
Alyssa?
Yes.
Hey, so it's Kathy from New London. So we were kind of gathering our thoughts today before the meeting, and so we have had opportunities for the environment tool to do a lot with that. But like one of the assistant directors said, she feels like she's doing 3 ISPs. It seems like because we're already making sure that naturally that the environment and the support is there, the connection is there, that most of the children that we're starting with the support, the connections tracker, we're ending up doing the ISP. So they felt that it was making the process much more lengthier than just going to the ISP, and that's kind of some new feedback that we were talking about. And Lori, did you have something to share in regards to?
Just the initial paperwork to me, I felt like it looked very similar to each other, like all the different pieces of paper looked very similar, if that makes sense.
I think there was, like, when you go from, I think what she's saying is when you go from the connections tool to the environments tool, like the beginning of it, it's like there's some redundancy.
A little bit.
Am I wrapping that?
Mm-hmm. And it's so timely that you share this feedback, because actually Neely visited Coronado this week, and her and I had a conversation, very similar conversation, about the environmental practices planning tool, and how maybe if you go through the connections practices and you're coming together as a team, the direct care staff are involved, you're planning support, it's kind of clear after that if the child needs an ISP or not. So we were thinking maybe we would translate that environmental practices planning tool into just like a supplemental tool, like a checklist, still use some of the influences information that's in there, and use it as a kind of a reference to do the connections practices, if that makes sense at all.
It definitely makes sense.
Yeah, and because I think the other thing that I want to mention is everything with supporting inclusion is case by case. So sometimes, you've been doing this long enough where if you get a child, then the trainer, as a trainer, Lori, you're observing, you can see, okay, this child's got some needs that really need some consistent support, versus maybe if we really work as a team, we can mitigate some of these challenges that we're seeing. So there are some kids for which you might go straight to an inclusion support plan, and there is some flexibility in the process to do that. I think always thinking case by case and knowing that the tools and the processes are there to kind of piece together for each case, even though there is an order, of course, 1, 2, 3, but it can always be adapted to meet the needs of the child. Does that make sense?
Mm-hmm.
Thank you.
Okay. Thank you for that feedback.
Do I need to do something to mute us back so you don't hear all the background noise?
You can press *6 to.
*6. All right. Thanks, Alyssa.
Okay. Any other thoughts? Big picture challenges? You can also type them in. So I want to share what we're planning to revise based on your feedback. We're planning to make a couple changes to the inclusion support form, one of which may be changing the title because it's very similar to inclusion support plan. So it might be something like accommodations form. It will likely incorporate the word accommodation somehow to make it clear what it is, and also have it be distinctly separate from the inclusion support plan, even though they're kind of A and B. There was some feedback around indicating what to do if no is selected when you're answering the questions, because there's a couple where there's guidance if yes, do this, and there's no guidance for if no, so we're going to go ahead and add that. There was a couple comments around adding a reason for IEP referral section and folks not feeling like there was a space to write why they wanted to go to their IEP. There's kind of general notes at the bottom, but really wanting a space that's designated to say why they needed their IEP support or why they felt like they couldn't make the accommodations with existing resources and program operations. So we're going to add that. We're going to revise Section 4, which is the complex needs section, to make sure that the language applies to a child who's enrolling in the program and not just a child who's already participating. So being really careful, because you may have a child that comes in right from the get-go and it's very clear that they have complex needs just in that first conversation with the family. So we're going to revise that to make sure it speaks to both children who are already there and children who are going to be enrolling. And then there was some other feedback around integrating parent collaboration components throughout the section. So there's kind of in the checklist itself, it's kind of at the bottom when you meet with the family and invite them to IEP. So the program's giving us feedback. It's like, we're meeting with the parents and we're talking to them a lot earlier in the process. So we want to make sure that we have that integrated throughout the form instead of just kind of towards the bottom. So we're going to look at how to do that. Okay. Some more planned revisions around the program-initiated path, which is the Section 3, is we got some feedback around including the training curriculum specialist in the process from the beginning to support the staff. I think the way it's currently written, it might be implied but not explicit because they kind of go to the director to alert the director of the need. So we want to make sure that they're working in collaboration with their trainer to do that. We know the support tracker needs more space because people are filling it out on paper. So we're going to definitely look at that. And then I already talked about this, the environmental practices tool, perhaps converting it to an available tool rather than have it be written into the process so that programs don't feel like, hey, we already did a lot of this work. Now we're feeling like we have to do it again, and maybe have a different way to check in as a team and kind of look at that. Okay. So those are the planned revisions. And the things that we need to make decisions around, I think at this point, are the IEP meeting requirements. A lot of programs talked about, if we're not going to our IEP for a lot of our cases, we may not have a case within the quarter. So right now the policy states that you have to have quarterly IEP meetings, but with the revisions, you might not have cases each quarter. So that's something that we want to think about, and I wanted to pose the question, what do you propose based on your experience with the pilot? You can, press *7 and chime in or type in the chat box. Just thinking about IEP meetings and the frequency that's written into the policy currently. And I'm pausing just to give people a chance to think. Process through that. Okay. Well, we might just need to think through that a little bit more. And if you have thoughts, go ahead and type them in as we keep going. And the other thing we need to think through is the follow-up and review requirements. So right now there's quarterly reviews that are required, and perhaps this might change as well. It might change to annual or more often as the child's needs change, or, for example, they might transition from toddler to preschool, they might transition from CDC to SAC or SAC to middle school teen. And so in those cases where they're completely changing environments or completely changing programs, they would need to be reviewed because, of course, the accommodations are going to be different in a totally different environment in a totally different program. But maybe looking at that quarterly requirement differently in terms of as needs arise or as changes happen versus quarterly for every single case. Okay. So I see people kind of typing in their thoughts around this. Still important to meet quarterly. Yep. And that I just read Kathy's comment about meeting quarterly to set aside the time to touch base about what's happening at each facility. I think that's a really great point. I think a lot of times our IAPs are kind of very child specific, very case specific, but they could be a bigger resource than we're utilizing them as. They could be a think tank, for lack of a third term, around inclusive practice and around, the bigger needs of each program or of each installation around inclusion. We really need better training on sensory integration, or whatever it might be, and having that IAP be your connector to some local resources around supporting inclusion. So I love that idea, Kathy. Could be me. This is my life's work here. And then, so thank you for sharing your thoughts about kind of placeholders or having them quarterly or thinking about the meetings differently. Those are all great ideas. And maybe having a memo system where you state, we didn't have any cases this quarter so that it's documented. Those are all great suggestions. Are there any other implications for policy that you ran into or started thinking about as you piloted the process? Like, how's this going to work with this requirement? I just want to make sure there's not anything I'm missing in terms of policy implications that we really need to think through. Oh, Teresa, if you press *7, does it not work? I see a comment about not being able to unmute. Let me just unmute everyone for a minute.
The conference has been unmuted.
Alyssa?
Teresa? Yeah?
It's Neely. That was my message to you regarding Teresa's comment above.
Oh! Sorry about that. I'm not sure what comment you're talking about because I can only see a little bit of the chat. But is there something? Okay? Yeah,
she just suggested that if all accommodations could be made within the program, that they be allowed to write a memo stating that. So somewhere on stating that accommodations were made within the program and they could be able to document it somewhere. She says that their installation is unique in that most of their IAT cases are food allergies.
Right. Okay. Great point. Thank you, Mary.
The conference has been muted.
So while we are thinking about other policy implications, I'm going to bring up another poll. And what I'm asking here is, I don't know if you can see the whole sentence, but it says, based on my opportunity to pilot the process and tools, I recommend we. And there's three choices. There's kind of the first choice is make decisions and revise the OM. Like, we're ready. We learned enough and we can make changes. The second one is, let's start to make some changes, but let's continue the pilot. And the third one is, let's hold on decisions and continue the pilot. So what is your recommendation just based on your experiences so far? It's like, what would you recommend that we do at this point? We're really curious to know do we have enough information to move forward, or do we really need to continue the pilot so we can learn more? So I'll give everyone a little bit more time to chime in here. Okay. Let's get to our results here. Okay. So some folks feeling like we can make those decisions and move forward, and other folks feeling like maybe we can start to make changes, but let's continue the pilot for a little bit longer. And one person feeling like we need to just hold all together. Okay, so based on this, we will likely do the middle. We will likely start to make those revisions and continue the pilot. As I'm saying that out loud, I'm wondering if the OLC has been helpful as a collaboration space, and if you want to just kind of continue to pilot and note your observations so that we keep getting that information as we're making revisions, rather than saying, boom, we're done with the pilot. Of course, you can always come to us with additional feedback. But it looks like we will start to revise the OM and continue with our pilot using the OLC, and of course, anyone can reach out to us anytime. But if you have any thoughts about the OLC collaboration space, you can go ahead and type them in. So our kind of tentative rollout plan of how this is going to go is for the fiscal year 19, we're piloting and we're preparing. So we're going to start to revise the Inclusion Operating Manual. We're going to develop some webinars and some trainings to start introducing this to the field, because it is very different from what the current process. And then in fiscal year 20, it would be more full implementation. The policies would be implemented across Navy CYP, and the KIT site visit would focus on supporting the new process. So not this fiscal year, but next fiscal year when KIT comes out, there would be some sort of coaching component around the new process, just to provide that additional support to the installations as they're learning this new process. So now I would like to pick your brains about training and support for the field as we're thinking about rollout. What existing trainings have been helpful? Where do you see the need for more training around this? Like, where do you wish we had given you more information or more examples for so that you could really grasp and learn the process? And what additional support might be required? So I'm going to unmute everyone just so it can be more of a discussion as we think through this. So.
The conference has been unmuted.
One of the things that was very helpful for my IAT, because we weren't in an installation IAT, we were a regional IAT, and we just broke down into doing it installation wide. So the training on KIT for members of the IAT was extremely helpful.
The training, are you referring to the orientation?
No, like so on the KIT webpage, there's trainings for IAT members of the IATs that kind of describes what the IAT is about, what the role of the board members are, the members of the IAT are. So I had all my members that I pulled together do that training. They found it very helpful.
Okay, awesome. So having an installation level IAT and giving them information about what it was really helpful.
Yes.
Okay, awesome.
I also really enjoyed the Connect and Redirect because we were able to get all of our staff members to watch that video once it became not in just available to the pilot, which I think the teachers really benefited from.
Awesome. So having that specific kind of training around a strategy was helpful because they could all view it and all get on the same page. Thanks.
When it comes to additional support with the paperwork and the process, I would like to maybe get some suggestions, a little bit more clarification on what to do with those children who start the process but don't necessarily get to an ISP on it, but still have to have the support tracker. I guess if I'm being clear, because I feel like some of the children at our center didn't get to the ISP, but we still will do support trackers for them.
Yes, I completely hear you. And I think a lot of kids, as you start to do the connections practices and track supports, won't end up needing an ISP. So you're saying, like, how do I close the loop?
Yeah.
Okay, yeah. Yeah, so there is, like, a space in that inclusion support form where the directors sign and say, the needs are supported at this point. But I hear what you're saying. Like, it doesn't feel like it comes full circle.
It almost feels like we just say, okay, we don't need it anymore.
Right. Yeah, no, that's great feedback.
So maybe just a case example of someone who we're slowly weaning off of the support trackers.
Okay, yep. So how to fade support.
Right.
Okay. Anything else that, I know it's hard to think back to September, but anything else that was particularly tricky to learn or that you feel like there wasn't enough information around that we should be thinking about?
Alyssa, this is Kathy from Coronado, and I don't know if Neely brought this up after she met with us on Tuesday, but to put something in about kind of what's going on in the home environment on one of the forms to just kind of let us know, like it might be that, the family might be going through divorce or deployment or, so we can see what's going on, at home, but then also what's going on, at the center. Like they may have had a change in the teacher. So, and this is more like with the behaviors and that kind of thing. So I don't know if that's been mentioned as well.
Mm-hmm. Absolutely. I think being more explicit throughout, both in like the forms and the tools, with the, like, for lack of a better term, like sprinkling in the family pieces a little bit throughout instead of having them always at the end, I think will be really helpful. So thank you for that. Yes, Neely did share. Okay, any other thoughts on training or how this is rolled out? Is there anything that was helpful within your team as you learned this together?
I think what was helpful was that, and this is Shauna from Sunbase New London, helpful was that we needed to have all those signatures on each form, and it pushed us to really make sure that we were getting everyone that needed to be in on the meeting, because sometimes with time or with staffing, it could be hard previously, so we would work with who we had in the meeting, but I think this pilot really forced us to stop and look at scheduling and look at how we can get all the needed members out to participate, and I think the staff really appreciated that.
Mm-hmm. That's true. And, we see that as trainers when we go out on our site visits, because we have feedback meetings with staff, and it is hard. It's hard to schedule it, but so crucial when they've got a child that has. So kudos to you for figuring out. That's awesome. That's the feedback that I've received, that one of the big benefits is that everyone has felt like the teachers are more a part of the process, and that's a very positive experience. So you're kind of echoing a little bit of that, is that like making sure that they're there at the table each time that their child is discussed is really important. Makes a big difference. Okay.
Alyssa, this is Marianne. Can I just share a couple of things? I know I said that I wouldn't say anything during the meeting, but I just wanted to share a few points, if I may. First, I want to ditto what Alyssa had mentioned earlier at the beginning of the conversation. Is thank you so much for doing this for us. It's really important for us at CNIC to make sure that the processes that we are establishing and developing are practical and that they're implementable at your programs. So I thank you for the feedback that you're giving us. We look at it very positively. We want to make sure that the tools and the resources and the processes make sense to support, of course, the children and you guys who are supporting these kiddos in your programs. So thank you, and continue to share. I do want to share, I've been a part of an OSD working group with all of the other services. And one of the things that I just recently shared was our Navy inclusion pilot. The other services were very well aware of what Navy was doing prior to this pilot, but went through the pilot and some of the new resources and tools that we've been looking at. And I have to say, everybody was very, very excited about what the Navy is doing. And it looks like the other services may adopt our way of processes with regard to inclusion. So I think that puts even more on our shoulders to make sure that, you know, we're getting this right, so when you guys, you know, some of the questions that Alyssa asked earlier about reviews, you know, OSD, from what I gather, is going to start to implement some requirements around reviews, around a process for making sure that parents are getting in timely for those types of things. So we ask the questions with intent because we want to be ahead of some of those requirements that, you know, people at 50,000 feet make. So give us that feedback. You know, using that example earlier, is right now we have an annual requirement for CDCs. A quarterly requirement for CDCs, but we have an annual requirement for STAC. What makes sense? Do they need to be different for the programs? This is the type of feedback that we need from you guys. As Alyssa said, I am good with carrying on with the pilot so that we learn more, we refine our tools, we do whatever we need to do, because I think that once we roll this out, as you guys know, once it becomes a policy, it's hard to take it back then. So this really is our opportunity and your opportunity to give us feedback to make sure that this process works for you guys and the children that you're serving. So I'm glad to hear that we're going to, you know, start to make the revisions, but I really do ask that you guys be honest and share those things that we need so that we can make really thoughtful decisions going forward. And now, you know, it does appear that the other services are going to utilize this process, and they're waiting for the Navy's pilot to be over. I think that that's really exciting for us as well, that we're leading the way on this piece of it. So that's really exciting on this end. So again, I thank you. Alyssa, I didn't mean to interrupt. I just wanted to share a little bit about what OSD is doing. You know, they are really focused on inclusion right now. The services have been very voiceful about what we're doing, how we're doing, the resources. So there is a lot of focus on this area right now. And the more information that we can give them, I think the better decision making they'll make also at that level. So thank you.
Yes. Thank you, Marianne. And I think everyone.
The conference has been unmuted.
Oops.
The conference has been muted.
Okay. So from here, what will happen is I will type up, I will add to the summary document that I have with all of the feedback, adding some of the comments and everything that you put into the chat box today. And we will continue with our pilot. So you can keep going and keep adding things to the OLC. You can reach out to Neely or I. I anticipate that as we start to revise that OM, we may reach out to some of you to review some of it. But we do, as Marianne said, appreciate your ongoing communication and your honesty about how things are really going, because this really is going to affect possibly every child and family in the military, which is so exciting that you all are leading the way. So thank you again. If you have any other thoughts or comments, please do share them. And otherwise, thank you so much, and have a wonderful
The conference has been muted. The conference has been unmuted.
Alyssa?
Yeah.
Right, so I just chatted, so we're gonna continue. I'm sure it's gonna be for a specified time frame with the pilot, but we're doing ISP renewals, and we're getting, med admin renewals, different EAP, so forth and so on. Can we begin to put those children through the same process? Because it's very confusing to maintain two different processes, and it's confusing on the IAP board that they're going to be reviewing routine cases, and then they were told we're in a pilot, they're going to be reviewing those cases that we can't have accommodations for. So I guess I'm just looking for an approval to be able to put them all through that process.
Yes.
Oh,
go ahead.
Go ahead, Alyssa. I was just going to say yes.
Okay, thanks.
Yes. For those pilot sites, Alyssa did share that you guys are, there's some challenges trying to go through two different processes. So for the pilot sites, and I have advised even the inspection team who you guys are, if you guys want to start using the processes for all of your children, go ahead and start doing that. Especially, as Alyssa said, we're probably going to carry this on the rest of the year and gather more information as we're making the revisions. And as you guys know, revisions take a while. It's not just the OM, but as you had mentioned earlier, we have to make changes in SIMS, which is a beast. And it's not like we can have one turn on and one turn off. As if we make a change in SIMS, it's a change for everybody. So there's a lot of work that we have to do throughout. So I do understand and appreciate that running two processes is difficult for you guys. So yes, go ahead and use it, this pilot for everybody.
Thank you.
Okay, any other questions? Okay.
I just want to say that again, we thank you for, allowing us to participate in this pilot. It's been a great opportunity for our program, and we're learning a lot through it. So while you're thanking us, we thank you for the opportunity.
You are most welcome.